It's coming to fruition,
I know.
We've broken ground.
We have not officially, but we've started the moves that are going to make it possible. And that's people and buildings and all of the effort that's come together. It's really extraordinary for us.
Is it complete? I mean, are we all set now? I mean, what else do we need to do?
So on our way to getting here, life changed on the island. A housing crisis became worse. We are grateful to the community for getting us to our goal. And with the enthusiasm and momentum that's continuing, we're going to take it home, literally by building housing, so that we can staff this remarkable new hospital for this community with the best quality physicians and care deliverers and nurses. And so we're taking this into a housing phase.
Did we know that we would be doing that? Was that part of the plan? Or, I mean, I know things come up.
It wasn't part of the original plan 4 years ago,
Right.
but in healthcare, as in everything, you have to respond to what happens on your way anywhere. Health means flexibility and responsiveness to conditions, and our community has enabled us to be responsive in this way, and that's where we're going. It's the hospital's moment.
Yeah.
We don't want to be coming back in 2 years, 3 years. This is the moment to really secure health care for the community. You see the enthusiasm here at the health fair.
It's been a great one.
I mean, it's local.
Amazing.
It's Nantucketers for Nantucketers. It's our hospital.
How about insurance and the cost of it affecting the community? I mean, they're here, but we're all trying to find ways to pay for it, whether it's subsidized or you have the money to afford to do some of these procedures. Where are we going to go in the future? How do you see the future of healthcare for our island?
I see more and more challenge to find innovative and smart ways, just as this building is a smart building, to address the high fixed cost, low volume, and seasonality of what is Nantucket healthcare. And we have found ways to do this for 105 years. We're going to continue to find ways to do this.
Do we have to find ways through those visitors that come only in the summertime? I mean,
think
is that
we
our
will,
primary
we
reach
will.
out?
Well, you know that over 50% of the donations for this hospital are coming from islanders, year-round full-time islanders, and then from seasonal islanders. So, because we're all islanders.
Yep.
But that's a remarkable demonstration of year-round support, and that's what is going to bring this community together for its hospital. It's not the amounts, it's the numbers.
Now, what if things change and we do become a single payer healthcare like the rest of the world? Would that change anything?
Well, let's assume, that things are going to change, because we've already been talking about how they change.
They're going to.
And we
They're
will.
always changing.
And we will find the best wisdom in the moment, working with our partners, we have remarkable depth of experience with Mass General, for example, and partners that we've made for many years on the Cape and in Providence to deliver care here. We've always been problem solving, and we'll continue to do that.
When can we expect it to be completed?
We are, once having focused on where this community wanted its hospital, which was at this existing site, we have wasted no time, and we've had a very aggressive timeline that we've actually achieved. So we will be breaking ground on the building itself in the first quarter of next year, so 2017. And we anticipate opening the door by the second quarter of 2018. So buckle up.
Here we go.
I know. Here we go.
It's exciting.
It is.
It's going to be wonderful.
It's historic. And the other historic thing is, because of the Department of Public Health, 5% of the total project cost that has to be distributed in the community for collaborative and innovative new health solutions. This is a historic opportunity for other healthcare delivery systems in the island to receive money and a boost and an opportunity out of this project. And the hospital is very excited to set it up this Wednesday. There is out at the VFW one of the first of 2 preparation meetings to show people how to apply for the grants. The grant money will start to be. We have pulled together a community team to decide to review the grant applications, and the community will decide this. Not the hospital, the community.
What grants would these be for?
For substance abuse, mental health, for children and families. They're to nonprofits.
Okay.
But anybody who has a wonderful idea can work with a nonprofit, and that's the spirit of this DPH money, to bring collaboration together into the community to serve its needs. So we have identified what the community feels it needs: housing, access to health care, mental health, and maternal and child health. And those will be the big themes. But so much can happen within that, and we have to stop thinking as a community that we are working with impoverished resources. This is a moment, and it will not happen again in our lifetimes.
Exactly. Okay.
And it's now, and we'll start distributing the money December 2017.
Good to know.
And I think the grants are going to be due sometime in March.
Okay.
So there's some time, but it's time to start thinking, really dreaming about what we need and what we can do, because it's our moment.